Diagnosis of shoulder infections, especially after total joint arthroplasty, can be challenging. The Musculoskeletal Infection Society has criteria to help you diagnose these infections. Major criteria which indicate infection include a fistula communicating with the implant or 2 cultures obtained demonstrating the same organism from either joint fluid or tissue around the implant. Many times, diagnosis of infection is not that easy, and so 3 of 5 minor criteria can also be used to help diagnose infection. 5 minor criteria for diagnosis of infection include an elevated C-reactive protein, an elevated white count, positive neutrophils in the joint fluid, positive histology at the time of surgery, and 1 positive culture of either the joint fluid or the tissue. It's important when you're submitting cultures to have those cultures held for 14 days. Many of the organisms are slow growing and difficult to diagnose. These include organisms such as C. acnes and coag-negative staph. There are a number of other factors that may lead a clinician to suspect infection. These include changes on radiographic images and even unexplained pain. So let's say you suspect an infection. In certain cases of uncertain diagnosis or microorganism or excessive bone loss, 2-stage exchange may be more appropriate. In rare cases of severe bone loss or significant medical comorbidities, resection arthroplasty may be the right answer. In my practice, an infectious disease physician provides me with recommendations regarding the duration of both IV and PO antibiotics. A team-based approach can provide the best outcomes with the lowest reinfection rates. In general, the diagnosis and management of infections can be challenging. Using accepted protocols can result in streamlined treatments and improved outcomes. In conclusion, a lot of recent research is focused on infection. Using that research, we can reduce the risk of infection for your patients and improve your patients' outcomes. In this class, we covered the shoulder biome and the epidemiology of infections. We also covered preoperative and intraoperative strategies for reducing infections, along with ways to diagnose and manage infections if and when they occur. Thank you for joining this advanced class on shoulder infections as a part of the Stryker Teach series.